hundreds of thousands of students pursuing professional careers will be in limbo starting next year when it comes to paying for higher education. The so-called Big Beautiful Bill eliminated a loan program that's used by most students pursuing careers in medicine or law. Thanks for joining us here for our news tonight at 7. I'm Edie Lambert.
And I'm Curtis Ming. KCRA 3's Denson Cortez shows us how these federal changes have local impact on California and students.
So what kind of percent LDL reduction can you expect?
Before they could heal the sick.
What about the milligrams on that one?
Or file life-saving prescriptions.
Their vitals are pretty good.
Students first have to afford the degree.
Those Grad PLUS loans really, like, if they didn't exist, I wouldn't be here. My dreams would just be crushed.
Caleb Mendez is just one of nearly 2 million borrowers relying on Grad PLUS loans, a program implemented nearly 20 years ago, allowing professional students pursuing medical or law to borrow up to the full cost of attendance.
Every other school was just either too far or like in an area where I didn't really think I could afford to live in.
But starting next year, that's all eliminated, as future professionals will be limited on finding funds to finish school.
I am only funded by loans and my own savings.
July's Big Beautiful Bill restructuring next year's student loan sector, setting a cap on how much students can borrow, leaving many scrambling.
There's going to be a loan limit for professional students of $50,000 annually, and then $200,000 for those full professional programs. Is $200,000 enough to cover tuition?
No, not at all. Right now, I'm just fully focused on school, not working, going off of that savings that I have, and that savings is not even a tenth of that.
It's a hard pill to swallow, and it's a dilemma universities are aware of.
More than 1,700 students across all of our healthcare and law and other professional programs rely on it. That's a third of our overall population. That's a huge number.
The ripple effects will reach beyond campus. California is short of 500,000 new healthcare professionals to meet the demand, especially in areas like Stockton.
This is a nationwide problem. It is especially going to hit healthcare providers and healthcare schools that are teaching the next generation doctors and nurses in areas that are underserved, like us.
Do you see any private loan sectors now taking advantage of this with the Grad PLUS program going away?
Private loans can absolutely fill a little bit of the gap, but ultimately, private for-profit loan providers are not going to offer a $200,000 loan or a $300,000 loan to a first-generation low-income college student.
And it's just going to be those that can afford it. And it kind of just cuts off and eliminates the 90% of us who definitely cannot afford it.
In Stockton, Denson Cortez, KCRA 3 News.
Congressman Harder and other leaders in Congress are working on legislation to extend the Grad PLUS loan program for universities in areas deemed as a medically underserved area.